Blunt chest trauma. What will it most commonly involve? That most fixed part.
C.
Ligamentum arteriosus is what need to be remembered. Secondary versus primary thyrotoxicosis, you should know the differences, doctor. Pretibial myxedema. Basically, pretibial myxedema and orbital proptosis, they are more common in primary thyrotoxicosis rather than secondary. Of course, this terminology of primary, secondary are no more in that much a common practice in the modern endocrine textbooks. Autoimmune thyroiditis will lead to
lymphoma.
Lymphoma. What is wrong about neuroblastoma unlike FEO? There are no symptoms created by catecholamine excess. Invasive breast cancer is more common with papillomas. Papillomas twice the normal risk of cancer. Once more, in the Bailey and Love or any surgery textbook you have, which lesions of the breast, moderate risk, mild risk, increased risk, no risk. You have to be quite sure. Fibroadenoma of the breast is not a pediatric problem. It is a full grown breast, fully developed breast from which fibroadenoma will be typically developing. If you have any other school of thought, please protest me. I am assuming that, yeah, our student rightly said, as such we didn't eat the breakfast, we are running to conclude the paper, but yeah, please raise your objections or your possible original native answers which went wrong against our key. If you say, then we will debate on that. Now, because you are all now EG PGs, exam going PGs, so that's the reason I think 80% of you will be knowing most of the answers. Am I exaggerating that? Maybe 20% will be knowing most of the answers. That will be a true statement. Now, what's your answer? Increased risk of breast cancer.
B.
It is not multiparity but nulliparity which is the risk factor. Small cell lung cancers. Basically, they arise from neuroendocrine cells. By the time you detect only, they are spread. So they are not generally dissectable, is what need to be remembered. Most cardioplegic solutions contain potassium. Potassium arrests the heart in diastole, is what need to be remembered. 45-year-old male who is a heavy smoker, what is least typical feature of the pain?
Sir, asystole is a symptom of hyperkalemia, no sir? Asystole.
Asystole is a feature of
hyperkalemia.
But there the reason is ventricular fibrillation leading to VT, VF and cardiac arrest. So in this case, potassium depolarizes the cell membrane and arrests the heart in a diastole. That's the idea. 45-year-old
A.
Otherwise you can remember asystole, no systole, so what is there is only diastole, because the heart stopped in diastole, whichever the way. Yeah, what is your answer? So where is the pain maximal, doctor?
Knee.
Typically in the calf.
Sorry, calf.
Calf is a classical location. Yeah, any objection? Normal ankle brachial pressure?
1.
1. And when do you call it as ischemia below? 0.9. Critical when? 0.3. This is ABP is a very common question. What is the best graft material you want to use for the femoropopliteal arterial bypass?
C. Saphenous vein.
Autologous saphenous vein is what you need to remember. Intestinal claudication, खाने में टेंशन है, कुछ खाए तो पेट में दर्द हो रहा है डॉक्टर साहब, क्यों होता? Celiac artery, SMA or inferior mesenteric artery, anything that supplies the intestine, atherosclerosis can involve and that can lead to development of intestinal claudication. Because CA is there, SMA is there, yeah, I think C should be, it's a ill-framed question, agreed. Question suffers miliary TB. Huh? I mean questions will not come like this by mistake. Any of the above has gone in a wrong place. Maybe here we should keep some subclavian artery or something else and then conclude it as D. Moist gangrene is least with, whenever gangrene develops acutely it will be moist. Any gangrene that develops slowly, slow occlusion is going to be a dry gangrene is what you need to remember. A patient has got an ankle injury, requires amputation. So what is your answer? A, that's right.
Yeah. C.
A you said, eh? No, the point is generally it is good to amputate as distally as possible. But if you are planning for a prosthesis, below knee prosthesis fits better than that of an ankle level prosthesis. That's the reason we amputate it until below knee and then put the prosthesis rather than amputating at the level of the ankle. Where are most of the aneurysms of abdominal aorta? Where are they located?
Distal to renal arteries.
That's right. Infrarenal is the most common location. What is the main reason for the venous ulceration in the people?
B. Varicose veins.
It is a venous hypertension, and that will invite a lot of trapping of leukocytes which will initiate proteolytic enzymes that lead to development of injury to the tissues leading to leg ulcers. GARD, where you don't need 24-hour pH monitoring, doctor. Who presents with heartburn? If there are symptoms which are highly suggestive of reflux, there is not much of role for 24-hour pH monitoring. Columnar cell lined esophagus, what is your answer, doctor?
C.
You thought it as A?
No.
Nafis?
No.
Oh, very good. Adenocarcinoma of esophagus. There can be short Barrett's. It is not 5 centimeters. 3 centimeter होके भी short Barrett होता है, long Barrett होता है. Which is not true about paraesophageal hernia.
C.
Endoscopy is not better because endoscopy mein you are passing endoscope, not seeing here and there. But if you put barium, it will nicely paint the entire mucosa and show the herniation, which is missed by endoscopy.
Sir, with for this endoscopy with a side hole is available, it seems, sir.
No, the idea is optimal diagnostic technique. Optimal diagnostic technique. Ulcer you can see on endoscopy and also by barium. But if I say what is more optimal technique?
Endoscopy.
Now, a barium can identify those shallow ulcers which can't be picked up by endoscopy. But in colonoscopy that is not true. Between colonoscopy versus barium follow through, barium will score over that of the colonoscope because it can even pick up those shallow ulcers which can be missed by the scope. That way, optimal diagnostic technique we mean. Which is not a feature of H. pylori, doctor. H. pylori.
D.
After eradication, reinfection will not occur generally. That's a important point. After vagotomy, there is a development of epigastric fullness, sweating, tachycardia, diarrhea. What is your diagnosis, Nafis?
Dumping syndrome, early dumping syndrome.
Which dumping?
Early.
Early dumping. Honeymoon में ही dumping करना is early dumping. How will you treat it, doctor?
Subside.
Over time the syndrome will subside by itself is what you should tell your patient. Why does this basically occur? Suddenly high osmolar food enters into small intestine leading to circulatory hypovolemia which stimulates the sympathetic system reflexly. That lead to all sympathetic clinical features is what need to be remembered. What is wrong about the internal anatomy of the liver?
D.
So what is falciform ligament dividing liver into?
Anatomical.
Anatomical. Who divides it into functional
Hepatic
Cantley's line is the one which divides into functional. CT is showing 5 centimeter solid tumor in the liver which is hepatic adenoma. What is wrong about it?
D. D.
That's right. Adenomas are benign vascular lesions. Treatment mainly is by excision, and there is a malignant potential for them, is the point of interest. If we don't know this fact, we will not, we will think OCPs की वजह से वो होता है ना, OCP बंद करे तो वो भी चले जाएगा, वो नहीं चले जाएगा, that is important. Breast में mass, liver में mass, there are the two things which can be expected after taking OCPs, especially if the female is 35 to 40-year-old. There are a good number of patients who will come to your OPD. Doctor, I took OCPs, doctor, sudden resurgence of romantic spirits, and this breast mass has started. Is it cancer? Just about a week back, I had a patient, she is virtually terrified. She works in Google. She works for Google. If you go to Google and say breast mass, other than breast cancer, उससे कम कुछ भी नहीं बोलेगा Google. So lot of patients will be scared about cancer by reading Google. Unfortunately, there is no disclaimer in lot of blogs. Ideally, if it is a blog hosted in other countries, legally you need to put a disclaimer. If the virtually the patient was in almost a suicidal depression, in the history there is no family history of her, nothing was there, and mammogram turned out to be a benign swelling, everything is happy, she is ultimately comfortable, but all the culprit is the OCPs, right? Of course, in her version it is her husband who is responsible for all this. Ultimately husbands will be responsible for everything. So that's the reason you need to know how to identify benign mass. Neonate is diagnosed to have type 3 biliary atresia. How do you want to treat?
Kasai, B.
Portoenterostomy, Kasai procedure. And later part of life, if required, liver transplant need to be done. Triple vessel coronary disease is there along with one gallstone. You want to give Dasara offer? Coronary bypass karo, gallstone free karenge. So what is your option? Treatment only for coronary artery disease, don't do gallstone. Asymptomatic. What is the need? 10-day history of abdominal pain suggests pancreatitis. How do you like to confirm? Anybody answered amylase? Amylase become obsolete, especially with a 10-day history. CECT is the best situation. Annular pancreas, easy question. Duodeno jejunostomy. Agar ye question wrong kare to next year get ready. You don't need to even apply the application on a lighter wing. Now, what is true about omentum? Omentum. In children, omentum is poorly developed. Peritonitis is very common in children, which is true. If it is studied with nodules, it is more likely to be carcinoma, is true. In thin individuals, omental torsion is common, not in the obese. It is not the entire colon where it takes origin, only transverse colon is the omentum, is what need to be remembered. Non-specific mesenteric adenitis, nursemaid syndrome versus appendicitis, how do you differentiate?
B.
Anorexia, classical feature of appendicitis. Agar wo nahi hai to you need to rethink about appendicitis. Agar appendicitis ka suspected patient is saying, Papa idli lao, dosha bhi lao, puri bhi lao, sabko lao, मुझे पेट में दर्द है बोल के रो रहे हैं, तो वो appendicitis का patient नहीं है. Anorexia is basically suspected. So Spasms of abdominal coli with intervening pain-free intervals is a classical feature of non-specific mesenteric adenitis but not that of appendicitis. Now doctor, cemented implant versus other types of implant, what is the difference? We use polymethyl methacrylate. The advantage of the cement is that it will exactly fit. Its exact fit is not necessary, it will go in fit. Total hip replacement, doctor.
D.
Selecting the correct type of patient is a frequent MCQ in the exam. Indications for total hip replacement.
Sir, D. In D also.
D. No, why you thought D?
Because it's 85 year with severe osteoporosis, nothing is done. Hip replacement.
Why nothing? He want to go for a second honeymoon with his fifth wife. If it is America, 85 बोले तो छोड़ देते क्या? If he lives up to 100?
Osteoporosis is replacement.
With marked? Okay, is it a contraindication? Treat osteoporosis and manage the arthritis by giving hip replacement. Who stops you? Doctor, add age to the aged is WHO theme. Nowadays, elderly people want a hip replacement, participate in a discotheque, nightclub, because in their days it was not there. Nowadays it is there. So they want to participate in online MD entrance exam if they only did MBBS. So be very sure, because in their days it was not there. So those who are only on analgesic and physiotherapy easily controlled, don't do replacement just because you have a December year of the end sales offer. Confirmed septic arthritis, how do you want to basically manage, doctor? What is the first therapeutic option? Urgent open drainage of the pus is the rule. Under anesthesia. Sometimes arthroscopically also you can drain the pus in the modern time. Chronic septic arthritis of hip, what is the best thing that you want to do? Surgical debridement and put an implant after 8 to 12 weeks is the important principle. Benign tumors of the bone marrow. Where is the location for osteoid osteoma?
Humor diaphysis of
Diaphyseal. So it is generally painful, relieved by salicylates. It has got a bony nidus. Classical features of osteoma. They are painful. Who said painless?
Most common bone involved osteoma.
Bone involved in?
Osteoma.
Osteoma or osteoid osteoma?
Osteoid osteoma.
Diaphyseal, whichever the bone that has a good shaft, it will have to stay there. So commonly femur or tibia, basically. Osteogenesis imperfecta. What is the most severe type of osteogenesis imperfecta? 2. 1, 2, 3, 4 does not mean 4 is more severe. Achondroplasia. Autosomal dominant in nature. Please mention if you have any specific points to argue, let's fight. We prepared very well for these questions. Rheumatoid arthritis, classically involving metacarpophalangeal and PIP joints. If you answer this question wrong, you can still prepare. 8 weeks, 6 weeks time is sufficient to know what is difference between osteoarthritis and rheumatoid arthritis, psoriatic arthropathy versus seronegative spondyloarthropathies. Still there is a good time. Now doctor, primary osteoporosis, what is accept about it? D? That's good. The most effective therapy is biphosphonate therapy. Let me tell you, doctor, lot of students will have confusion between osteoporosis, osteomalacia, hyperparathyroidism, primary, secondary. How do you differentiate? And Paget's. Pakka you must know where is calcium elevated, not elevated, all differences. एक question जरूर आएगा. Dysplasia, congenital dislocation of the hip. What is the most important predisposing factor, doctor?
A. Acetabulum.
Dysplastic acetabulum and anteverted femoral neck is the underlying pathoanatomy. Optic neuritis mein what is the accept? Let's run. There is no abnormal electroretinogram because it is most post-retinal in pathology. Chalky white, optic disc is not a feature of traumatic injury. Ogden's index is classical of electrooculogram, we will be using it. Endophthalmitis, there is no scleral involvement in that. Late onset endophthalmitis is generally due to Propionibacterium acnes is what you need to remember. If you don't get any time to read ophthalmology, at least only AIMS previous 20 years ophthalmology. I am giving you some compromise solution. What? Huh? Okay, 10 years ka 10 to the 20 papers. 20 into 10, 200 questions. Padh ke jao, doctor. See, you always should have plan B. Plan A is ideal student. No girlfriend, no boyfriend, no boy or girlfriend. Every day, 18 hours like a catatonic schizophrenic studying with no deviations. Grandmother died, no problem. Grandfather divorced, no issue. You are continuing to read without any perturbations, that ideal student. Non-existent, let me tell you. Existent regular human beings at the age of 25 means, hey, your girlfriend is talking to other boy who is having a good job in Microsoft. Is it like that? You get up and then start running. You settle down the issue, come back and read 10 pages in Harrison. Then suddenly somebody calls, your aunt is having a knee joint replacement, she wants you to be on her side. You are there for another 1 week out and then come back. There is a common situation for most of the people. Then you wanted to read good, but you got a common cold. Life is unreasonable, but still, जिंदगी की सबसे बड़ी चीज नहीं गिरने में नहीं, गिरकर हर दफा उठने में है. Every time fall, rise, fall, rise, fall, rise, and ultimately you will win. So don't be disappointed. मेरा टाइम टेबल ऐसा दिख रहा है मगर मेरा रियल टेबल ऐसा दिख रहा है. Tabular analysis will be totally different, doctor, let me tell you. We all pass it through the same stage of what you are passing now. 18-year-old comes to eye casualty. So plan B is at least 200 questions of AIMS questions, because AIMS has the highest center of ophthalmology in the country. उनका क्वेश्चन बैंक से कम ऊपर there will be nothing asked. So that's the reason you try to at least read that. Okay, what is your answer on hyphema? Circularis iridis major is the main contribution. Von Hippel-Lindome, where do you find?
Cerebellum.
Cerebellar hemangioblastoma is what you find. Orbit is showing calcification. Only tumor that you know in ophthalmology is?
Retinoblastoma.
Retinoblastoma, better bet on it. Then enlarged corneal nerves is not a feature of?
Herpes.
Herpes simplex keratoconus, but leprosy, keratoconus, everywhere you find. Anybody answered keratoconus?
No.
That's called intelligently guessing wrongly in ophthalmology. Contact lens, where is proven to have deleterious effect? Why?
A.
Glucose is available, but utilization of the glucose is not properly done because oxygen comes to cornea from the ambient atmosphere, which is interrupted by your contact lens. So if oxygen is not there, glucose can't be used. Now purulent otorrhea with atic perforation, what do you suspect, doc? Huh?
CSO, unsafe CSOM.
Basically it is cholesteatoma. Surgical treatment. Internal auditory meatus, what will not pass?
C.
Chordae tympani doesn't pass. Tympanic membrane to the footplate of stapes, what is the ratio?
Controversy.
Huh?
Controversy.
What is the controversy?
It is 14:1 or 17:1.
Let me check. 17:1 is the known answer, no? Okay, we will leave for our online classmates to comment because they have the book in their front. I remember it as 17:1, but since you said 14:1, we will check that. Reservoir sign, where do you see, duck?
Mastoiditis.
Mastoiditis. Griesinger sign,
C. Pain tenderness.
posterior part of the mastoid. Pure tone audiometry is not for? Is not for? Cochlear sound is not measured. I mean true, is measured. Yeah, everything else.
Sir, B and D are also correct.
No, 1 minute. Cochlear hair cells produce low intensity. Cochlear emission, otoacoustic emission. Except should be there, doctor. Except should be there. Okay. Ear furuncle mein what is causative agent?
Staph. Sir, many questions are there like that, sir. All except something is missing in them.
Not many questions. Till now we
Many
found
are
only
there,
2, no? How many?
Almost 10 are there in the paper, sir.
10 are there?
Yes.
Are you sure?
Yes. Yes, sir.
Till now we found only some 2 or 3.
And in future.
In future, okay, we'll come to the future.
it's-
Maybe gynecology obstetrics में हो सकता, we will, but that is presumption. I'll show you where is the trick where it went wrong for you. Okay, we'll, till now how many? Only 2, no? Malignant otitis externa is
B.
uncontrolled. Then early diagnostic sign of the mastoiditis, sagging of the posterior superior part of the bony canal is one of the very early features. 15-year-old with offensive otorrhea with temperature
C.
of 35.5.
Temporoparietal C.
Right temporoparietal is what you need to suspect. Now doctor, let us talk about gynops. Who will get more than 20 in gynops? In today's paper are good in gynops. What is wrong about HRT?
Correct only.
Most idiotic question. Colon cancer and HRT has no relationship. What is C?
वही सर लास्ट टाइम बोले थे बोलते ना हमने पूछी ना निश्चला क्यों बोलते
C you want to say?
वही तो बोल
It is a controversial option, I agree. Some studies say the risk of coronary artery disease in fact increases because it will affect the lipid profile.
recent studies there is nothing like that बोल के है
Now, ovarian hyperstimulation, what is your answer, doctor? It is not a problem with insemination, but ovulation inducing drugs. That's right. Now, autosomal recessive,
All except. All except.
it's more common in children with parents of consanguineous is true. Okay. Third question where except is missing.
Not third, sir.
Fourth. Okay. We'll come back. Except should be there. Except should be there. Then a Siemens sample is said to be normal. This is not except.
B and D.
Huh?
B and D. B and D.
Only B, doctor.
Sir, but ejaculate normally is 2 ml. And
1 minute, I am coming. 40 million spermatozoa.
For ejaculate.
Oh,
B and D.
okay. B
Sir,
and D.
many are there, sir.
Okay, sorry. I think framing में थोड़ा इधर उधर हो गया. Fourth question, which was fifth.
Fifth.
Okay, WHO counts you don't forget, doctor. Very important. LH and FSH. What's your answer? You thought anything else, doctor? No? That's good. Because LH, when will it peak? 36 to 48 hours. I mean 9 hours before ovulation, 36 to 48 hours before ovulation. Estrogen has a positive feedback effect. Now clomiphene citrate?
Anti-estrogen.
Anti-estrogen. Okay. I am a little afraid on any other option I missed. What is wrong about hyperplasia? 40% only, very mean way of making you go wrong.
Anterior pituitary.
Okay. फिर भी आंसर ये तो एग्रीएबल नो 40% हो या 60-80% हो. Right. Anterior pituitary it arises. Premature ovarian failure.
Autoimmune disorders.
Autoimmune disorder, even viral infections are known to lead to premature ovarian failure. Gonadotropins except
D.
In hyperplasia they are not increased, rather decreased. Anti-Mullerian hormone, AMH, typically levels are not higher. Always what is the significance of anti-Mullerian hormone? It is a marker of the ovarian reserve. कितने अंडे बास्केट में है?
Sir, that is FSH, no sir.
AMH is used. Anti-Mullerian hormone is strongly used as a predictor. There are many other predictors also of the egg health, but AMH predominantly. Enovulation होता ना polycystic ovarian disease में, उनमें egg reserve कम होता, so AMH का levels higher नहीं होता, कम रहता. Oh, then that makes false should come, except should come. This is 6th question which went except was missing. Okay, I think we are going to become notorious examiner. Caesarean section jaldi bolo. Caesarean section.
A and B.
B I will contradict. ये तो correct है.
B is correct, sir. It is misprint 10%.
Is less than 1%, doctor. 10% बहुत ज़्यादा है.
That's what, sir.
We want a true statement, no? Option A is true statement. B wrong statement क्यों है? वो 10% नहीं है, 1% में हम, अरे हम तो मारवाड़ी सेठ है जी. 8% 10% के बीच में Agarwal traders will not accept for the same. That's important. With regard to shoulder dystocia, what is your answer? Confident answer. You are afraid to answer A, no? You think that every time only if the baby is big then only shoulder dystocia occur? 50% it will occur if the baby is more than 4 kgs. 50% it will occur if the baby is less than 4 kgs. That's the reason there is no preventive measure. If it is only occurring in the macrosomic babies, you can use preventive strategies. But they found that it can occur even in a normally weighing baby also in 50% of scenarios. Any other option is there in this to contradict?
B.
It occurs due to obstruction at pelvic outlet, you want to say? Oh my God. That is, the problem is at the pelvic inlet, not outlet.
No, sir. It's outlet.
Shoulder dystocia.
C is also correct.
The reported success rate is up to 90%. More than 90% is not up to 90%. Okay, doctor, getting 10th rank is not same as 11th rank. But problem is at pelvic inlet, doctor. We will check. You can once more review shoulder dystocia, pathophysiology, everything. This question is absolutely rightly framed. answer becoming A. B, your objection is overruled. Now doctor, अब तक हमारा wrong framing का कितना score है?
6.
6 हो गया, okay. 10 है तो better we resign from setting paper. Epidural analgesia. What is your answer? The woman's efforts to push the baby will be affected by the epidural. That's the reason it will prolong the second stage, not the first stage. It won't affect the cervical dilatation, anything. Third stage of the labor is said to be active when? Actively managed if the cord is clamped and cut early.
B.
Huh? B you want to say? B you want to say? It is diagnosed with prolonged, the placenta is not delivered 30 minutes after the birth of the baby with active management and 60 minutes with physiological management.
Delayed cut hai actually.
Definition of actively managed is, active management includes the use of intramuscular oxytocin followed by early clamping and cutting the cord and controlled cord attraction, Brandt and Drew's maneuver. Or any other answer? Other two anyway you are not arguing, no? I can go ahead. Our score is still 6, wrong where except is not introduced. Perineal trauma, at least this question we won't go wrong.
A.
You all agree with that? First degree injury to skin, injury to perineal muscle, not anal. Second degree, including anal, is third degree. 3A, 3B है उसमें. Less than 50% tear, more than 50% tear, and internal anal sphincter torn is 3C. And fourth degree is involving anal epithelium. Pre-labor spontaneous rupture हो गया doctor. Water is out. What will you tell your patient?
D.
Huh?
D. D.
C you want to say?
D.
D. Yes, you must counsel that 1% risk of serious perinatal infection is there. Why not? C. Why not C? 60% will go. Please give one big clap up there. One big clap. For tough framing of questions, you are not clapping the teacher. Very, very unreasonable. Right. Now, doctor. FHR tracing on cardiotocogram. What is your answer?
D.
Huh?
D. D.
D. Alternative answer? Non-existent? Okay.
No.
Any other where you want to bet? Okay. With regard to max sulfate therapy, what is wrong
Sir,
statement?
can you explain the other options also, sir?
They are all explained in the literature, my dear. I mean, you can just review. It's more easier to read rather than listening. Huh? With regard to max sulfate therapy, what is the wrong statement?
C.
Huh?
C.
It's a cerebral vasodilator, not a vasoconstrictor. Any famous wrong answer from you? Your sponsored answer?
Sir, D.
Huh?
D.
D. CDG shows reduced variability if you give max sulfate. That is expected in the cardiotocogram when you have given max sulfate. Huh? Now, vaginal colonization by the group B streptococcus during pregnancy.
Egalaxia.
Huh? Egalactacy. Then acute uterine inversion.
D. Active management.
D. Active management. It can occur following vaginal delivery. It can occur following even cesarean section. It can occur following physiological management of third stage of labor is what need to be remembered. And even it can occur with active management of labor. कुछ भी करो होना है तो नसीब में होगा. That's the point about uterine inversion. Complete androgen insensitivity.
A.
Phenotype, because the development of the breast looks like female. Precocious puberty. Oh, thank God, I was afraid. False was there or not. It is there, yeah. Cushing's में होगा, एडिसन में नहीं होगा. Cushing's में होगा, McCune Albright में होगा, encephalitis में होगा, or if you give exogenous estrogens में होगा. Then what is wrong about normal puberty?
A.
Thelarch is earlier, not the pubarch is what need to be remembered. What is not correctly matched?
A. A.
A you thought,
Sir, except seminoma, AFP is absent.
seminoma में AFP is there, no?
Absent. If Seventh question.
Seventh question, agreed. Still only 6 questions are there. We won't reach 10.
7
10
marks
wrong.
can throw down 700 ranks.
Agreeable. We will add 10 grace marks to everybody. Serum testosterone. What is except?
C.
C you want to say? That's right. Why? Because granular cell tumor is a female feminizing tumor where estrogen is produced.
Sir, Theca cell also feminizing, no sir?
Which one?
Theca cell tumor is also feminizing.
Theca cell is virilizing only, doctor. Now, cervical glandular intraepithelial neoplasia, what is wrong about it? One confident answer? Huh? It is usually asymptomatic. Glandular lesions are either an incidental finding or diagnosed with along with squamous lesions. Unlike the squamous intraepithelial lesions. Why not? D. D you want to say? D or C? D. Cervical glandular, yeah, it can be associated with the skip lesions higher up in the endocervical canal. That's the reason if you find glandular lesions, what will you do? ECC. Endocervical cytology is what you need to do, so that you can catch up those skip lesions which are hiding in the endocervical canal. Got my point? If you find atypical glandular lesions when you do PAP, then you need to do ECC. You also need to evaluate endocervical canal. What is the contraindication for ECC? Pregnancy is a contraindication because that will lead to development of a early abortion. That's the reason we don't do ECC in that scenario. C, C. HPV is implicated in both the things. (18) is implicated even in case of glandular lesions also. True. Then atypical endometrial hyperplasia, what is except? You like to say? Yes, it is not with coexistent cervical cancer, but abnormal uterine bleeding, any hyperestrogenic state, it can be coexistent, endometrial carcinoma can be existent, anything can happen. What is wrong about the pre-malignant lesion? B or A? CIN progressive CIN3 or worse in 26% of women in as far I remember, B is right, doctor. Just check that. Check the option.
Yes, sir.
CIN1 to CIN3 progression in 2 years, other than 26%, what is the figure in the mind? 1%. Maybe the 2 years may not be applicable in that 1%.
Sir, that is why just follow up is done, no sir, without doing anything.
नहीं, already statistics है, उसके ऊपर logic भी. वो नहीं होता डॉक्टर, वो देखना पड़ता, और एक बार बुक ओपन करके शॉ में क्या लिखा है, रिसेंटली क्या हो रहा है देखना पड़ता. Very good. Then what is the wrong statement about fetal circulation? Huh? Most of the blood which enters the right ventricle, how is it pumped, doctor? You need to review the lung bypass. I leave the literature for you. Huh? Now, what is wrong about peripartum cardiomyopathy? Huh? Nulliparous or multiparous? Peripartum cardiomyopathy going into cardiac failure is more often a feature which is seen in the case of the multiparous patient is what need to be remembered. Okay, doctor? So that brings us to the conclusion for this week, and we hope to see you once more on Wednesday. Friday discussion, Friday we were in a hallucination of ecstasy of vacation after a long time. So this Wednesday onwards we will have discussion. And you want paper really to be more easier than this? How many would like to say? I agree, 7 excepts are missing is fatal. Yeah. Other than that, the standard of questions. How many hate it?
Sir, we want just correct questions, sir. No controversies. All except should be there. Otherwise, confusion is being created, sir. That's my opinion.
There are only 1 to 2 controversial points in the options.
Like rare questions, rare topics are like asked, no, sir. Some rare topics. So
you must be prepared to accept
No.
10 to 12 rare topics in real exam also.
Yes, sir. But in them there should be no mistakes with the questions, sir. Like except and those things should be there, sir.
Excepts nowadays has become a tendency in the state entrance. If you see previous paper, except, at least some 50-60 questions are excepts.
No, sir.
But anyway, we will try to make the questions much more supple and smoother. Thank you.